Thursday afternoon on your community radio station, Radio West Fife. The time's just gone 1:30 and we're joined in the studio by Mr. Alan Shields and also Natalie Bate from NHS Fife. How are you both doing?
Doing very well, thanks.
Good. Now, you're here to talk about clinical waste today. First of all, what role do you play within the NHS, Alan?
Well, at the moment I've got two different roles. Within the NHS itself, I'm one of the community pharmacy champions, which means that I play a supportive and training role to 17 pharmacies across Fife of the 84 that are there. But I'm also the pharmacist and manager of Dysart Pharmacy. Obviously we're a standard community pharmacy and help to support our patients and dispense and advise through all services.
So, what about yourself, Natalie? What's your role within the NHS?
I'm the communications officer for pharmacy, so it's up to myself to help promote what pharmacies can do, and I run campaigns like this one, like Medicine Waste, to help show what pharmacists can do.
There's a statistic here that says over £2 million worth of medicine is wasted in Fife alone every year. How on earth can this happen?
What happens is there's anyone who's on a repeat medication will get their repeat every 2 months. Now, whether they order that themselves or whether they order it through their pharmacy, for whatever reason, it doesn't always happen that the patients take them every single day when they should. There are a number of factors that can influence that, whether the patient's not feeling well, whether they've had a change of therapy, whether they actually just don't like taking their medicines, or whether they've only to take it when they need to, but they feel under pressure to always order on time every time. And what happens is they get a massive build-up in their homes, and that does eventually then come back to pharmacy to be disposed of safely, but it results in a massive cost waste across the NHS as a
whole. So you can't reuse these medicines. Why is that?
It's a safety issue. Within pharmacies, the medicines are always acquired through the safest means, and it's all traceable, and the medicines are always safe to use, have all been stored correctly. Whenever that leaves the pharmacy, it's then not under any control at all. And I certainly myself wouldn't fancy taking tablets that I haven't known where they've been stored or kept. And that's why any medicine that has left the pharmacy premise, even if it's been unopened or untouched, if it's brought back in, it always needs to get disposed of purely for patient safety reasons.
Now, in terms of people who are hoarding or collecting medicine they don't really need, who would you say are the worst offenders?
I wouldn't say there's any specific type. There are some people who may have broken a leg a number of years ago and they got painkillers at the time and they just like to maintain a stock of whatever painkiller it is in the house. Or there's some people that get started on a medicine, didn't agree with them, but they like to keep their doctor happy by continuing to order it even though they're not actually taking it. So it can be anyone from babies and toddlers and that the parents are ordering for right the way through to the...
I mean, is it worth stockpiling like this? Is there ever likely to be a medicine shortage in Fife?
No. You'll have seen in the media over recent times that there are some stock issues with a small percentage of medicines, but they are always rectified fairly quickly. What we see as being a supply problem is 3 to 4 days. Each pharmacy gets deliveries every half day. So if there is ever a medicine that we need to get hold of, then we generally get it in for, if it's in the afternoon, we get it in the next morning. If it's in the morning, we get it in the afternoon. So in terms of the availability of a medicine, even if the pharmacy doesn't have it in stock, they can always get it pretty quickly. So there's never any need to stockpile.
I mean, what is your general advice in terms of reducing medicinal waste in Fife?
The main thing is that you only order what you are going to be needing. Now, I'm not saying that allow your cupboards to get bare and leave yourself short of medication. There is procedures in place that if you have run out of medication at a weekend or whatever, there is extended opening in our pharmacies where if you are in that situation, you can get medicines. However, when you're coming to reorder your medication, it's very easy when you're coming to do it just to say, do you know what, order everything. And medicines are free, and there does tend to get that logic into your head that because it's not costing you anything, that it doesn't cost anything at all, which isn't true in the slightest. So when you are reordering your medicines, only ordering what it is that you're going to be taking and what you need. If there's something that you're not taking or that you're choosing not to take, then have a chat with the pharmacist or the doctor about that and get your medication reviewed. There are always other options available rather than just kind of going with the flow with it.
Natalie, you are launching the campaign to tackle this. What can I just describe this as an obscene waste of money? I mean, what are you going to do? What are you trying to do? How are you going to approach the subject?
Well, what we've tried to do is we're going to launch it officially on the 10th of September, and we've tried to include everyone, not just the members of the public, but members of staff at NHS Fife, GPs, pharmacists like Alan, and people who work in care homes, because we all take medicines or are carers of people or who have parents who take medicines, and it's all up to ourselves to realise what do people actually take, and do they need to order any more, or can they just start that dialogue with the pharmacist and understand what they're taking. So we're going to launch the campaign outside the Boots Pharmacy at Central Retail Park at 2 o'clock on the 10th of September with a number of colleagues, and from then we're really hoping to get some knowledge about the campaign running. But it's not a short-term campaign, we're really hoping it's long-term and that people really do change their behaviour and realise, how important medicines are. They do cost, but obviously it's very important to take medicines.
Yeah.
There should be no guilt attached to medicines that people need. It's just that over-ordering or ordering just in case, there's really no need to do that these days.
I mean, you're talking £2 million worth here. What else could be done with that money?
Lots.
Yeah.
We really could employ a lot more staff. We could get community midwives, community dentists, we could upgrade facilities, you get better systems. It's
So
quite a lot of
basically,
money.
everybody benefits from saving medicines and using them wisely.
One of the most expensive parts of the NHS is its drugs bill, and it's something that is always closely watched, and that's why a number of patients will notice some changes to their medicine to move them over onto a slightly cheaper alternative. It will still do the same job, but it's just a cheaper variation for the NHS to use, and that's why all these efficiencies come into play, because you want people to get the correct therapy and effective therapy, but also you don't want to be overspending on it, and that's really what this does. With an extra £2 million buys a lot of extra GP time, buys a lot of, as Natalie says, dentist time or community midwives. So anyone who's ever had a wee grudge about not getting an appointment or not getting a chiropody appointment in time, or anything to do with NHS about not getting seen in the time that they want to be seen, well, £2 million goes to
A
really
long way
helping
towards
that.
helping
Yeah.
that situation. My local pharmacy is Balyeoman Pharmacy, and I know for a fact that they often automatically reorder medicine for you as part of their repeat prescription scheme. How do you counteract that?
Well, it's something that more and more pharmacies are doing. It's great from the patient's perspective, because it means it takes the worry out of their side of things. Whenever they need their medicine, it's just going to be sitting there ready on the shelf for them. One thing that could be focused on is that obviously the pharmacy are reordering your medication based on you needing it every 56 days, and there will be some items in there that you don't take all the time, some things that you just take when you need to. But if you don't let the pharmacy know, they will just continue to reorder that for you, and that all accounts to some of the wastage. So if you are on one of these systems, make sure that when you're collecting your medicines the previous time, or contact them in between cycles, just to let them know that there are some medicines that you don't need reordered for the next time. So although the pharmacy is reordering it for you, we still need the input from you as to what you've got and
good
what
communication with your pharmacist, really.
Exactly.
And
exactly.
Something else that springs to mind as well. My mum was in hospital a few months ago, and she was most surprised to find out that she had to take her medicine with her. Why is that?
Well, it's best to take medicines with you, because then there's no delay in having to order medicines once you're into hospital, and then you can take them back out with you. So it actually stops you having to wait for medicines, and you know what you're taking. You'll already have a stock, and it just makes the whole system a bit smoother and no delays, so it's a lot safer as well. So if you do go into hospital, remember to take all your medicines with you.
So if people want to find out more, how can they do that?
Well, like I say, the campaign's launching on the 10th of September. We've organised some bus advertising round about Fife. We've got some posters at the railway stations. I'm doing presentations to GP staff and to care home staff, and hopefully there will be posters all around every hospital in Fife, including the smaller community ones, and it will be more well known after that. There's also going to be events in shopping centres across Fife, so look out for a stand in the Kingsgate and the Kingdom Centre and the Mercat in Kirkcaldy.
So all over the place, really going for it, getting the message out there.
Yeah.
Are people able to contact you via the internet at all? I mean, everybody seems to be online these days. Have you got an email address people could...
Yes, it's natalie.bate@nhs.net.
Superb. Well, Natalie, Alan, thanks very much for coming along this afternoon, and good luck with the campaign. I hope it works. I mean, it's going to be to everybody's benefit at the end of the day.
Absolutely.
Yep.
Thank you very much.
Thank you.